So you've been diagnosed with a sore throat. Here's what you need to know and a bit of what you might like to know. So people catch a sore throat, also called pharyngitis if you want to use the medical term, when they are being coughed on by someone else who's sick, when they kiss someone else who's sick, when they touch something that is contaminated by someone else who is sick. So if the surface has been touched by someone who's sick, then you put your hand on that surface and you put your hand to your mucous membranes, that would be your mouth, your nose, or your eyes, then you are going to catch the virus. And that will give you the sore throat that you're now experiencing. Now, I did say virus. The majority of sore throats are caused by a virus. Antibiotics do not work on a virus, so don't always expect that you will get a prescription for your sore throat. Since 80% are caused by a virus, all that's going to happen if you take an antibiotic is bacterial resistance, and you also may develop a new rash, which is from getting the virus and the antibiotic together. About 20% of sore throat is caused by a bacteria. That's called strep. So you've heard of strep throat. Those cases do need an antibiotic. So you should be getting an antibiotic and taking it as directed for the full course. I know it's very difficult if you're giving it to a child to take it as directed 3 times a day, for example, but it's very important that you don't partially treat them. That can also encourage bacterial resistance, and it's not very effective for your child. You want to take it the whole time as well. Finish the prescription. Don't stop early. Reasons to suspect that it is a strep throat, the reasons that we use, either we swab the back of the throat and wait 2 days to see if it comes back positive for the bacteria strep, or we go by some clinical symptoms like you have a true fever that's taken and documented at 38.0 degrees or higher if you're using Celsius, or 100.4 or higher. So that's number 1, you have a true fever. Number 2, you have no cough. People with a bacterial cause or strep throat do not have a cough. Number 3, you have really big lymph nodes. Underneath your neck we can feel them. And number 4, you have a white exudate or sort of a pus covering in the back of your throat when we look back there. If you have many of these symptoms, then we're likely to give you a prescription without waiting for the culture to come back or the swab that we took of the back of your throat to come back. But if you don't have these symptoms, then it's a virus and there's no point in treating you with an antibiotic. Things you can do when you do have the pain is you can take acetaminophen or ibuprofen, which is also Motrin or Advil. You can use throat lozenges or gargle with warm salt water if you find that's effective. If you've been diagnosed with a viral cause and it's mono is caused by a virus, the EBV virus or the Epstein-Barr virus, you're also going to be very tired and weak for the next 7 to 8 weeks or so. In adults and teenagers, it lasts a long time. And in those patients, you must avoid contact sports. That's because the EBV virus, in addition to causing a sore throat, also often causes swelling of your liver, which is just under the right side of your ribs. Normally it's hidden by your ribs, and your spleen is under the left side of your ribs. The EBV virus causes both of those organs to swell, so now they're exposed. They're not protected by your ribs, and if you get punched or hit in the abdomen, then you can rupture your spleen or damage your liver. So you do not want to play contact sports when you have mono. You must avoid them and must avoid getting hit in the abdomen. Otherwise, you'll suffer those consequences. Reasons to come back to the emergency room would be is if you have difficulty swallowing fluids, you can barely pass basic fluids or your own spit, or if you're having difficulty breathing. That's a reason to come back to the emergency room. Number 2 is if you have persistent fever or pain that's not getting better. And number 3 is if you develop a new red rash. Those are reasons to come back to the emergency room. Otherwise, follow up with your family doctor if things aren't improving significantly. I'm Dr. Atzema, and those are my discharge instructions for a sore throat.